Hello, everyone. We're back in the second part of the workshop. I'm wondering if I can turn to Luke Ogden, and if we can start. Hi, Luke. And if we can start with your presentation around the call helpline. Thank you.
Afternoon, Prananda. My name is Luke Ogden. I'm the Helpline Services Manager for C.A.L.L Helpline. So there's a couple of logos here because I manage other helplines for Wales. So I'll just briefly talk about the other helplines quickly. So if we go to the next slide, please. So there you can see C.A.L.L Helpline, which is the All Wales Mental Health Helpline. We've got Dan 24/7, which is the All Wales Drug and Alcohol Helpline, and then Wales Dementia Helpline. Next slide, please. So for C.A.L.L Helpline, what we offer with respect to mental health is ongoing emotional support, a listening ear, advice and signposting. So the advice and signposting tend to go hand in hand. With the signposting, what we have available to us, to all the staff here, is a database. Now the database has got over 1,500 services to be able to signpost to. So these are local and national services. Not all of them are related to, the key subjects of, like you see above, dementia, mental health, or drugs and alcohol. Some of these are, related to jobs, finances, relationships, those kind of things. Topics which may have a negative effect on your mental health. So we don't advertise ourselves as a signposting service because that's just something that we do in addition to supporting people with their mental health. Next slide, please. So C.A.L.L Helpline stands for Community Advice and Listening Line. It used to stand for Clwyd Advice Listening Line because it was just set up in the North East Wales area. If you click on the next slide, please. So we originally started in 1995. So I think next year in April it marks the 30 years since we started. Now we started following a consultation with mental health, community mental health team service users, and a lot of the feedback from the service users was to do with most services being in operation only from Monday to Friday. And that Friday at 5 o'clock all the way to Monday at 9 o'clock is a huge amount of time. They found that there were just no services to support them. It was either no services or emergency support. So we put in place C.A.L.L Helpline, Clwyd Advice Listening Line at the time. And we were in operation from 7 p.m. till 11 p.m. in the weekday, and then 12 till 12 on the weekend. This obviously gradually got busier and busier, and we took on Dan 24/7. Dan stands for day and night, dydd a nos. So because of that, we were able to operate 24/7. Next slide, please. So the means of contacting the service is the helpline. That's where we get most of the contacts from. We did have a texting support service. That's changing to emailing support service. So you just put on there for now. The email service coming soon. I will follow up once that's launched. If I'm able to share that with you, Claire. We also understand that people, although they need help, they at times can't or don't want to phone a helpline. So we have to, we're quite aware of that. I mean, some of the anecdotes are to do with younger people. Younger people don't like speaking on the phone. They'd rather send a message instead, which is fine. So that's why we're putting the email service in place. We also have the website callhelpline.org.uk, And on that site, you can go onto the agency search for your own services in your area. You could also do your self-assessment on there. Although it's not an official diagnosis. It's the Patient Health Questionnaire 9, so you can have a look at things like anxiety, depression, anger, alcohol. Make your own assessment, and it will come up with a score. It may or may not advise you to contact your GP for the support on those specific subjects. We've also got Twitter or X. I don't know what you call it these days. We'll go with Twitter and Facebook. So we do a lot of updates on what other services are doing. A lot of services do projects, so we'd like to share those things on social media. It's also a means of contacting our service as well. So if somebody wants to send a direct message, they can do. All they need to do is search for these usernames that you can see on the screen, and we could respond them via that. We do try to share as many different service updates on social media as we can do. As I say earlier, we're not a signposting service, but we feel it really does help if we're sharing the information of other services across Wales. It's that partnership working that that was mentioned earlier. Okay, next slide, please. So a couple of questions on here. Who is the service for? So the service, the call helpline, is for anybody living in Wales. So we don't have any sort of age restrictions on there. Who is the target audience? Now this all depends on things like the awareness days, weeks, months. If we had any sort of correspondence from Welsh Government, if they want us to focus on marketing on certain thing. It also depends on the data received. If there are holes in the map, say if we're not receiving a lot of calls from Swansea, for example, we need to be looking into that and using that as our target for marketing. Last question is a very difficult question to answer. There's no one size fits all with this. How do we reach certain demographics? Now, the data that we have produced from our contacts that we receive, we see low levels of contact from rural areas often, and our usual marketing, like the digital billboards, they just won't work in those areas. We can't stick up a billboard in somebody's farm, for example, just for obvious reasons. So we have to try and look at the area. Why are we not getting calls from there or contact emails from those areas, and what can we do about it? So if you click on the next slide, please. Just the next one, tap. Yeah, so the awareness days, these are the ones that we like to focus on social media. So it just helps us to have a look at what other services are doing. So the Alcohol Awareness Week, as an example, fits in quite well with mental health, with substance use. World Mental Health Day, 10th of October. It's a day where we try and look for sort of celebrating what other services are doing, what projects are ongoing, and if there's any sort of face-to-face drop-ins anywhere in Wales. International Men's Day on the 19th of November, and Movember, which is the Men's Mental Health Awareness Month. So trying to, it's a sort of difficult balance, because obviously we're saying the helpline is available to everybody living in Wales. So we have to try and manage it quite carefully, so we're not showing people of Wales that it's just for men. But also, we're all aware that there does need to be focus on men's health. Next slide, please. So this is just some of the data. don't want to bore you too much with this. I find this quite interesting. So the helplines data, so this is from last year, from January to December 23 per 100,000 population. So on this is what I'm talking about in terms of the, let's have a look at what the data tells us. And what this data tells us is that we are quite lacking in contacts from certain areas. I've highlighted some of these here. So the Rhondda Cynon Villa Glamorgan, Bridgend, Torfaen. So, my action from this is to have a look at what's available in those areas to advertise. Is it radio? Is it a mobile digital advertising van? Is it face-to-face engagements, events, contacting the health board, that kind of thing? Those are in terms of reaching people in certain areas. It's there may be some ways that we can do it that I'm not aware of, which I'll go on to in a minute. If you click to the next slide, just on this one, obviously the huge outlier here is Ceredigion, and we're still yet to find out why it sticks out so much. It's not that we're particularly focusing on Ceredigion area. As I say, no idea why that's popped up. Needs looking into. Next slide, please. So this is a huge reason why we need to look at focusing on men. This is a pretty horrific stat, really. 74% of the deaths from suicide are from men. Horrendous. So there obviously needs to be more work in advertising to men, in my opinion. Next slide. This is just the gender split. So this is not based on calls that we've received specifically with suicide. This is the contacts received overall on the helplines. So obviously we do have more calls that are female than male. I put unknown in there. Unknown are when we get text messages and things like that where we don't know the gender. So this is again an indication that we need to do more work to focus on the male population of Wales. Next slide, please. So this is just a snapshot of what we've done so far to try and reach the male audience. We know that there are thousands of people who attend sporting events, football, rugby, and the majority of those people that visit those events are male. So we've worked together with Jonathan Fox Davis. If anybody's a Wales rugby fan, they probably know who this guy is. I didn't. I had to go looking. Not a big sports fan myself, but we've used him as an ambassador for C.A.L.L Helpline. He shared his some insight on his struggles with mental health. So it's just about engaging men in that way. Click on the next slide, please. Yep, there he is. And next one again, please. So we've tried to get decent coverage from this as much as we can. He helped us write this piece up. As again, speaking about his own experiences. I think some people like to think that if somebody is a celebrity doing very successfully, that they don't have mental health issues or they're sort of somehow immune to it. But I think having these stories shared just breaks that down a bit. Next slide, please. So these images are from Cardiff city centre on match day, as you could tell from the hats in the background. Some sort of promotional events here. They've got static billboards, paper billboards, and that kind of thing. But making use of these sort of mobile digital A boards, they can just on foot target the busiest areas. And as I say, in these events, majority of people are men. So you just you've got these images of men just having a chat with each other. They turn around and they see this information, and hopefully they pick up on it and note the information. Next slide. Again, I mean, this is the Sports Social Podcast Network. So there's an awful lot of podcasts out there, with a huge audience. So tapping into this means that we're advertising digitally on these podcasts. You can see some of the information there. 9 million average monthly downloads. So yeah, huge reach for majority male population across Wales. Next. Sporting magazine. This reaches approximately 40,000 people a year. I'm trying to make sure I'm not using this as a sort of marketing training, but just trying to sort of showcase how we're attempting to reach people in Wales. Yeah, to say 40,000 people a year with these magazines, which is a huge reach. Next, please. As I said, mentioned before, the digital mobile vans. The rural areas of Wales are hard to reach. As I say before, radio does so much. Engagements events are great, but if it takes you a long time to get on the bus or to drive to those locations, there's only so much success you can get from them. But these digital vans were able to get the adverts on the sides, on the back, and we're able to just speak to the driver and just say, actually, can you just go to X location? It is tricky because, I mean, some of the advertising, you want it to target the busiest areas, make use of your money, that kind of thing. Make sure that there's huge footfall in those areas so more people pick up on it. But you can't forget about the people in those rural areas. Next, please. So this is my last slide, and it's essentially call to action. There must be something that we're kind of missing out on in terms of reaching more men of Wales. As the stats show, we get we don't have as many contacts from men as we do from women. So I guess it's sort of to you really, just if there are any suggestions on how we can reach more people in Wales, more men in Wales. I'd love to hear from you guys. Am I okay to put my email address in the chat?
Yes, please do.
Yep.
Luke.
Yeah.
Yes, feel free.
Happy to answer any questions as well following that.
That's lovely. Thanks, Luke. Thanks very much. And I think we've